A patient and some former employees are coming forward with accusations of sexual misconduct against providers at a Central Ohio health system. Good evening to everybody, and thanks for joining us tonight for NBC4 at 6. I'm Kerry Charles.
I'm Colleen Marshall. Some of the accusers sat down with NBC4 Investigates Jamie Ostroff, who's been looking into those claims against providers at Adena Health in Chillicothe.
Well, Colleen, when you go to the doctor for a checkup or go to the hospital for a surgery, you want to know that your health is in the hands of professionals. The people I spoke with say the behavior of some providers at Adena Health was the opposite of professional, and the hospital has allowed that behavior to continue. Their claims range from sexualized comments to inappropriate physical contact. A warning for some of you tonight: the things you're about to hear might be disturbing.
You're not taking the situation seriously.
Two former employees,
inappropriate comments
of Adena Health.
I would cry, throw up, didn't want to go to work.
To have somebody that you look up to and work for make you feel so disgusting with yourself.
And a patient.
And it's then becomes very creepy, and you start to question trusting your healthcare provider.
Each of them telling their stories separately, unaware of one another's identities. We're not showing their names or faces to protect their privacy as alleged victims of sexual misconduct.
Dr. walked by, he touched my butt.
At first, this woman says she thought it was an accident in 2021 until it happened again.
Walks across, put his hand on my shoulder, went down my back, and grabbed my butt. I knew it wasn't an accident.
And this former employee also tried to make sense of what she thought was odd behavior from a different doctor in 2022, captured in screenshotted text messages.
One day I texted him asking what position he wanted a patient in for his on-call surgery, and he said, supine or doggy style, your choice. And I just kind of played it off. I was like, oh, okay, maybe, I don't know, whatever. Okay, I've heard worse.
But she says the suggestive comments continued, including in this image in which the doctor texts, "Let's make out." Then the employee says things escalated.
He wrapped his hand around my leg and tried to pull me into his chair.
2 days after that,
he blocked me with his shoulder on my shoulder and got really close to my face. I could feel him breathing on me, and he said, "I would do dirty things to you."
And this patient describes a blindsiding experience during a 2020 physical exam by a nurse practitioner.
Was check your spine, check your pulse, your breathing, all the sort of normal things that you would expect. And right at the end, the provider had told me, hey, you're of the age now for a prostate exam.
The American Cancer Society recommends men with no risk factors start getting prostate exams at age 50. This patient is under 50 with no risk factors. At first, he said he'd pass on the exam.
And he's like, man, don't be so weird about it. Sorry I didn't get to take you out to dinner last night. And so just more sexual innuendo type comments related to it. Things like, well, I'll turn down the lights, we'll put on some music, you take off your pants, I'll take off my pants.
The patient eventually agreed to the exam. The lights and the nurse's pants stayed on, but the patient said he still felt uncomfortable.
And then over a course of those weeks to months, I started hearing about other patients that went to the same provider with the same experience, the same inappropriate sexual comments. So I called the patient advocate group, told the entire story to them.
Each of these accusers tell me they reported the alleged incidents to Adena's administration. They describe similar, dismissive responses.
There was a letter from Adena. Adena regretted that I hadn't had a good patient experience or something to that effect.
The patient says he hasn't heard anything since. This former employee first reported her issue with a doctor to her manager.
She told me that it was my fault because we tell each other that we're very pretty. Your hair looks good today. Your makeup looks really good.
Then she called Human Resources. She says it took her 3 days to reach someone.
Asked me if I had made sexual advances towards him, and he disputed it. He had, and I'm like, no, Why are you accusing me? She says, well, these are just questions I have to ask. Well, I just need you to put it in an email.
The worker says there was minimal follow-up to her email. She quit about 2 weeks later in the middle of the workday after she says the doctor tried to touch her hair. The other employee also quit shortly after taking her issue to HR.
But I just didn't feel comfortable and feel safe being around him.
Now, I did reach out to Adina for a response to these individual allegations, and they told me in a statement, quote, Adina Health System is steadfast in our responsibility to provide the foremost care to the residents of Southern and South Central Ohio, as well as in our obligation to safeguard both our patients and caregivers. Although we will not disclose the details of personnel matters, nor of any matter related to an active investigation by law enforcement officials, Adina exhaustively investigates and appropriately acts upon reports of misconduct in the workplace and, as warranted, does so in collaboration with the appropriate regulatory and governing authorities.
Well, Jamie, this isn't the first time allegations of misconduct against an Ohio healthcare provider have surfaced. Certainly, as we've reported, the name Dr. Richard Strauss is infamous for this.
Yeah, we've heard that name several times, Colleen. So, Jamie, why are we not mentioning the names of the people accused in this story?
Yes, well, while the people I spoke with have filed reports with law enforcement, none of the men that they are accusing have been charged with a crime. And in at least one case, the accuser was told what happened was actually not a crime under Ohio law because of where on her body the accused allegedly placed his hands. One of the doctors accused of misconduct, by the way, is a traveling doctor based in a different state, and public records show he allowed his license to practice medicine in Ohio to expire last year.